18. Anxiety disorders. Anxiety disorders are among the most prevalent psychiatric conditions in the United States. Further, studies have persistently shown that they produce inordinate morbidity, use of healthcare services, and functional impairment. Combined with the acknowledgment that many people suffering from anxiety never present for treatment, these facts emphasize the importance of clinical research and exploration of this field. Defining anxiety disorders can be problematic, as there exists a fine line between normal adaptive anxiety and pathologic functioning. The revised 4th edition of the Diagnostic and Statistical Manual of Mental Disorders, DSM-IV-TR, attempts to do this by delineating a number of specific anxiety disorders with clear diagnostic criteria. These include panic disorder, agoraphobia, posttraumatic stress disorder, PTSD, and generalized anxiety disorder, among others. Anxiety disorders, like most psychiatric disorders, are usually the result of a complex interplay of biological, psychological, and psychosocial elements. Treatment of these disorders can be correspondingly complex. Understanding the neuroanatomy and molecular biology of anxiety promises new insights into etiology and more effective treatments in the future. There is currently an array of treatment approaches from the psychoanalytic to cognitive to behavioral to psychopharmacologic. Many times a combination of these treatments is utilized to best address the multiplicity of etiologic forces. Another fascinating aspect of anxiety disorders is the exquisite interplay of genetic and experiential factors. Students should also be aware of the role of specific neurotransmitters in the development of anxiety and the mechanisms of anxiolytic medications. The student should study the questions and answers below for a useful review of these disorders. Helpful hints. The student should know the following names, cases, terms, and acronyms related to anxiety disorders: acute stress disorder, adrenergic, aggression, ambivalence, anticipatory anxiety, aplesia, aversive conditioning, benzodiazepines, cerebral cortex, cleanliness, clomipramine, anafranil, conflict, counterphobic attitude, Jacob M. DaCosta, Charles Darwin. Disorders associated with anxiety: dopamine, ego dystonic, fear, autophagical, flooding, Sigmund Freud, GABA, generalized anxiety disorder, hypnosis, imipramine, tofranil, implosion, intrapsychic conflict, isolation, lactate infusion, limbic system, little Albert, little hands, locus ceruleus and rapha nuclei, magical thinking, MHPG, mitral valve prolapse, MMPI, Rorschach, norepinephrine, numbing, page 166, obsessive-compulsive disorder, OCD, panic attack, panic disorder, panicogens, peripheral manifestations, PET, phobias, agoraphobia. Social-specific, PTSD, propranolol, Inderal, reaction formation, repression, secondary gain, serotonin, shell shock, sleep, EEG studies, soldier's heart, stress, systematic desensitization, thought-stopping, time-limited psychotherapy, trauma, undoing, John B. Watson, Joseph Wolpe. Questions/answers directions. Each of the questions or incomplete statements below is followed by 5 suggested responses or completions. Select the one that is best in each case. 18.1. Physiological activity associated with PTSD include all except A, decreased parasympathetic tone, B, elevated baseline heart rate, C, increased circulating thyroxine, D, excessive sweating, E, increased blood pressure. 18.2. Mr. F sought treatment for symptoms that he developed in the wake of an automobile accident that had occurred approximately 6 weeks before his psychiatric evaluation. While driving to work on a mid-January morning, Mr. F lost control of his car on an icy road. His car swerved out of control into oncoming traffic, collided with another car, and then hit a nearby pedestrian. After referral, Mr. F reported frequent intrusive thoughts about the accident, including nightmares of the event and recurrent intrusive visions of his car slamming into the pedestrian. He reported that he had altered his driving route to work to avoid the scene of the accident, and that he found himself switching the TV channel whenever a commercial for snow tires appeared. Mr. F described frequent difficulty falling asleep, poor concentration, and an increased focus on his environment, particularly when he was driving. Which of the following is the most appropriate diagnosis for this patient? A. Generalized anxiety disorder. B. Posttraumatic stress disorder. C. Acute stress disorder. D. Adjustment disorder. E. Panic disorder. 18.3. Which of the following statements regarding anxiety and gender differences is true? A. Women have greater rates of almost all anxiety disorders. B. Gender ratios are nearly equal with OCD. C. No significant difference exists in average age of anxiety onset. D. Women have a twofold greater lifetime rate of agoraphobia than men. E. All of I.